Very good morning and welcome to the program, the only way to start your day. Good morning, Kenya. My name is Samuel Njoroge. How's your Tuesday? It's rainy right here in Nairobi. We do hope wherever you are, keep dry, keep warm. And it's time for us to have a conversation, this being the 24th day of April. It's World Meningitis Day. Do you know what meningitis is? Do you know what it's all about? How much information do you have when it comes to this condition? And do you know they say in medicine and in life that prevention is better than cure? And you can actually prevent yourself from getting meningitis. One, by having the necessary information. And number two, as we will be told on set this morning. Hashtag Good Morning Kenya 22162 is the SMS line. Begin with the initials GMK. Health Tuesday begins right now. I've got a panel of two gentlemen, and I would like to give them an opportunity to say a little bit about themselves. I'd like to begin with you, Sam, before I go to Dr. Tom.
Thank you, Samuel.
Yep.
Samindungu is my name. I work for a company called Sanofi Pasteur, which is a global manufacturer of vaccines, as head of operations for Eastern Africa. And it's a pleasure to be here.
It's a pleasure to have you. You also do have a background in biomedical.
Yes. I studied biomedical sciences,
Yes.
medical biotechnology option at Maseno University.
Great.
Yes.
Let me move to you, Dr. Tom. Mboya.
Thank you so much, Sammy, for having me today on the show. Happy that today is the World Meningitis Day, so we get to tell Kenyans and all the viewers about meningitis. So my name is Tom Boya. I'm a medical doctor by training, and I work here in Nairobi County. Yes.
Tuanze mazungumzo yetu asubuhi ya leo, na pengine uweza tuelezea kidogo meningitis ni nini?
Would you prefer Swahili or English? Yeah, you've hosted me a number of times, you know, when you're putting me in a corner.
Yeah, but let's do English.
Yeah, so meningitis is, in very explainable language, we call it infection of the lining of the brain. The more technical term for that is called meninges. So from the meninges, which is the word to mean the lining of the brains, infection of that lining of the brain is what we call meningitis, often presenting as inflammation, so swelling of those linings of the brain that manifest itself in the disease. Yes.
Does it manifest, or is there anything like types of meningitis?
Yes. We have various types of meningitis. The most common one is actually viral meningitis. Luckily for all of us as human beings is that the viral meningitis has a way by which in itself it is self-limiting. What that means is that even if you have the disease, it doesn't go to the severe forms for a big percentage of people. Almost more than 95% of the patients would recover even without treatment. But then the other forms, we have bacterial meningitis, which is a more severe form of the disease. And then we have fungal meningitis, which is also a relatively severe form of the disease. The fungal and most of the fungal one affects people who also have reduced immunity. So when your immunity is compromised, for instance, people living with HIV/AIDS, the commonest one among them is one we call cryptococcal meningitis. And for them, about 20 to 40% of all the patients, adult patients who eventually get these forms of meningitis, it's actually fatal. Yeah.
Actually, 30 to 40%?
20 to 40%.
20 to 40% is actually fatal. With that in mind, Sam, coming to you, you've been involved in medical research for some time in various capacities. What can you say are the main issues you've been able to identify research-wise as far as meningitis is concerned?
Well, as Dr. Mboya has ably explained, the various causative agents for meningitis, bacterial, viral, parasitic, and even fungal. So different categories of people have varying levels of vulnerability to meningitis. So for instance, of course, as the doctor has explained, younger children have a higher risk of bacterial meningitis, and also similar to the elderly as well. The teens and the preteens also, because of tending to be in crowded areas, also have an increased risk of bacterial meningitis. And yes, for those who are immunosuppressed for whatever reason, whether it's because they have cancers, or whether they have gone through transplant, or whether they have HIV, then they also tend to be at higher risk of getting cryptococcal meningitis, in this case the fungal form. However, what casts across is the fact that all of us are at risk of bacterial meningitis, and which tends to be very severe. Yes.
And therefore the hashtag this year around is All Meningitis Matters, and that is the theme that is being used to mark this particular day worldwide. So you need not worry. We right here have got you covered in terms of the information you need. And as far as meningitis is concerned, Dr. Tom, what are the signs and symptoms that someone could be suffering from meningitis?
So the signs and symptoms of meningitis vary depending on the type and also the severity. So for instance, for viral meningitis, which is relatively common, the signs and symptoms would be as basic as headache, things like nausea. But then the more significant ones that I would like the viewers to focus on is severe headache and neck stiffness. So this is not the ordinary neck stiffness where you sleep and then you wake up with a stiff neck. This is the neck stiffness that is associated with a severe headache. And then apart from that, now we have more serious, significant symptoms like seizure. So someone having convulsions with associated headaches. Then there are others now. These are others that can actually also be confused with other diseases. And that's why it's important that when someone has any disease-like symptoms, that they come to the doctors or to the hospital so that we diagnose. So anything that has nausea, you have the headache, you have seizures, could be vomiting, and vomiting is particularly common in children, which is projectile. So you vomit, but you don't vomit like on your clothes, you vomit a distance away. It's a sign of increased pressure in the brain. And then there could be things like photophobia, where when you come into a place that has bright light, then you feel like the light is actually burning your eyes. And this is like light that is shown on you, or you just feel like you can't go into an area of bright light. This should also not be confused, because there's a similar one that occurs for people with tetanus.
Yeah.
So these symptoms can look like they cross into each other, and that's why it's important for people to come so that we do proper diagnosis.
You know, right here in this country, we've got a history and a reputation of self-medication, over-the-counter, last-minute rush. How soon should someone see a doctor in the event you're suffering from meningitis or you present the symptoms?
So I like the hashtag for this year, that all meningitis matters.
Yeah.
Meningitis oftentimes is not a diagnosis in exclusion, because by the time someone presents to the hospital, they never really come thinking, I have meningitis. So they come with other symptoms, and then based on the symptoms, we're able to tick and see that this falls in line with an infection of the lining of the brain. And so someone can have non-related things, you know, like so many people have headaches, and headaches can be because of migraines. But then if there's associated stiff neck and probably altered level of consciousness, you know, by the time you get to those levels, it's really serious. So you come to the hospital as soon as you feel unwell, and that's why we always say you seek medical advice when you're unwell.
Kindly. It's very important to note that point. Let's take a break before I come to you, Sam. Let's take a break. After these messages, we shall be looking at diagnosis, treatment, and vaccination.
Devolution has greatly enhanced trade. More than ever, the trade sector has witnessed massive growth because county governments have made deliberate efforts to ensure that businesses flourish. Join the conversation on the 5th Devolution Conference in Kakamega County from 23rd to 27th of April as they share on the theme Sustainable, Productive and Effective Governments for Results Delivery.
Killed him! I killed him! I killed my son!
I came here to smack you across your face!
No, let go of me!
Try to stay calm. Calm yourself down, Karina. I have something very important to say to you.
Well, I have got nothing that I want to say to you.
I have an opportunity to hang on to the ranch. I've got a part of the ranch on a contract, and it will be mine after Elena is dead.
Eduardo, I can say definitely that you are the father of that boy.
I had goals. I still have the goals I haven't fulfilled.
Enyewe mzee yangu alikufa. Mtawachia nani watoto?
When a family member is diagnosed with cancer, the family gathers around them and offers them support. The role that they play in a cancer patient's life is simply undeniable.
It's important you get support from your family and before you go to support groups.
If I had met somebody at that time who encouraged me and told me, yes, look at me, I am fine, even you will be fine, it would have given me that much more psych to fight.
Yes, welcome back. We continue our conversation this morning. Health Tuesday focuses on meningitis, being World Meningitis Day. The theme being All Meningitis Matters, and that's the hashtag that's on Twitter today. Of course, to promote messages, questions, and concerns that are related to this particular condition. Before we went for a break, Dr. Tom Boyer was explaining something to do with how soon someone should seek medication. You had concluded your point, sir, had you?
Yes, I had.
Yes, he had. It's always good to clarify. I'd like to come to you, Sam. Owing to what Dr. has said, and this is a condition that potentially can kill you within 24 hours, I'm very sure you have a rejoinder to that, which would be?
That much as meningitis is rapidly progressing and could result in death in under 24 hours, most of the causative agents of meningitis are vaccine preventable. Perhaps more precisely, the rejoinder I would have is that prevention would be the best approach to protecting against meningitis, and that is through vaccination. By getting vaccinated against the various forms of meningitis, you have a better chance of living a full and complete life.
A full and complete life. But again, the last time I hosted you, we spoke largely on this issue of vaccination.
Yes.
And I don't know why people believe it should be only amongst children. People don't embrace the whole concept of adult vaccination, you know? In fact, after you left the show, so many questions were being asked in as far as the various conditions we discussed and how people can access vaccination to those very conditions. But this very one this morning, meningitis, is it an oral vaccination? Is it an injection? How is it conducted? After how long? At what age? All those questions.
There are several vaccines that are available. However, there's one that will take care of 4 strains. It's not one, there are more than one. And that would be the 4 serotypes that cause bacterial meningitis. It's not the only one. So there is A, there is C, there is Y, and there is W. So there is a vaccine that protects against the 4 serotypes, A, C, Y, and W135. There is also a B, which is separate, which appears as a single vaccine on its own as a B, which is today not available in Kenya. The one against the 4 strains is available and is given from 9 months of age. So from 9 months all the way. For children below 2 years, they would need to take 2 doses. For those ones over the age of 2 years, like the 3 of us here, suppose, you will require only 1 dose. Yes.
Below 2 years, 2 doses.
From 9 months.
Administered at what range?
So if the first dose is given today, the second one comes after 3 months.
After 3 months.
After 3 months.
And to our bracket, we only need 1.
Yes, just one shot. And it is, yes, it's a shot.
And it's a shot.
It is injectable.
Yes, kindly note.
Yes.
It's not oral. Ilazima. You know what I'm saying? Yes, this one you got to get a shot for it. Dr. coming to you. Earlier on, you stressed on the urgency of getting to a medical facility and getting treated. However, it's one thing to go to the doctor. It's another to embrace treatment, follow-up, and making sure that you follow instructions. Yeah. When I come to you and I'm diagnosed with meningitis, you've given me medicine and everything else, are there other things I need to observe, maybe nutrition, lifestyle, or those kind of things?
I think as far as meningitis is concerned, it's more of like an infective process. So from the clinical angle, we deal with the infection. So that is the medication.
Yes.
So if it is bacterial, we give you antibiotics. Most of the time, once we make a diagnosis of meningitis, which we do through doing blood cultures, we can use the evidence of infection in the blood to treat the systems. And then we do commonly, we do the spinal tap, which we call a lumbar puncture, where we draw some fluid, the spinal fluid from your back.
Yeah.
And then, that's a layman's language. I'm trying to make the viewer understand. It's more complex than what I'm saying.
Yes.
But then we draw the fluid and then we test it. So we look at it from the microscope and then we do a culture and see whatever grows from there. And then we do the CT scans, which we use to detect any inflammation around the linings of the brain. So when all that is done, after the testing and the diagnosis is confirmed, then we put you on treatment. So if it is fungal, we put you on antifungals. If it is bacterial, we put you on antibacterials. And then if it is viral, like Sam here has explained so well, can actually go on without treatment, without any intervention. You actually end up recovering. But then the problem with that is that even if it puts you down for just a week, there is the loss. The losses, both direct and indirect losses to you because of the illness. So treatment is really more categoric onto the type that we discover and we treat. But then apart from the medicine that we give, of course, diet is very important. These people, when you're taking any medication, now for any disease, whether it's malaria, whether it's pneumonia, you need to supplement not just the medicine, but with a proper diet. So you eat well, you drink enough liquids, you keep yourself rehydrated. It helps in the medicine to work in your system. And then eventually when you are off, when you are up and about, then you can go back to your normal life, exercising and all that. However, it's important to note that meningitis can present with complications.
Yes.
And in more severe cases, if you develop seizures during the disease, or as you are suffering from the disease, sometimes these ones can go on. So someone may actually end up developing things like epilepsy later on, even after the disease has recovered. So these are just things to look out for. But exercise, diet is just good for any disease that you're suffering from, and it's also just good for normal life.
For normal life. But on that part of epilepsy, that point on epilepsy, keyword being may develop. may develop epilepsy later, isn't it?
Yes,
because
those are the rare ones, but then
yes,
they may eventually develop, yes.
They may, you know, as I was going through feedback through this hashtag, there are people who sort of believe that ukipata meningitis and then you healed, it's more or less like later in life, kindly prepare, it's like an early sign, epilepsy coming up shortly.
No, not
the
at all.
The key word is
may, but that's a small percentage.
Yeah.
But that is only for diagnosis that was not made in good time.
Yeah, right.
And so that's why we are stressing on the importance of early diagnosis and early visits to the hospital.
Yep.
And proper testing and collaboration with the medical team. So when they tell you want to do a spinal tap, as relatives, you don't say, no, don't touch the backbone of our... No, you don't do that. You allow the medical professions to do their work and to treat your patient accordingly, yes. But a very small percentage may eventually end up developing epilepsy. But that is if the seizures during the meningitis infection stages were really pronounced.
Okay.
And actually, epilepsy is not the only complication, because as Dr. here has explained, the infection process, depending at what point treatment was sought, may have result in complications. And these complications may also include deafness. It may include mental retardation. It could also result in loss of limbs through gangrenous, you know, infection, the infection spreading to the legs or to the arms, and the same being amputated. It could also result in some organ failure, and someone could go to a situation whereby they may require a kidney transplant. I think it would, just to direct your viewers,
yes,
there is a famous musician who has been going around the world talking about high infection of meningitis called Amy Paddy.
Yes.
And Amy Paddy, Dancing with the Stars, they could have a look and see she actually lost both her limbs courtesy of meningitis. Her limbs, hearing in one ear, and a kidney.
Yeah, that's too much for her. That's too much. And she's been very vocal. She's been very, very vocal on this particular subject. But then there are situations, Dr. whereby loss of some kind has happened.
Yes.
Either you've lost an organ, you've lost a limb or your limbs, courtesy of meningitis. It's not easy embracing life after that. I mean, a lot of things change. So what kind of support system, what kind of palliative care does someone recovering from this kind of a condition need? For family, for friends, for the support system? What should they prioritize for this person?
Support system as a whole is also more specific also to the kind of losses someone has had. Generally, most of the time, because for instance, when you talk about bacterial meningitis, it can be a subsequent infection of the meninges as a result of another infection altogether. So for instance, someone may only present with pneumonia, so the infection is around the lungs, and they end up developing meningitis. And then because it is bacterial in nature, it is circulating in the blood. So that's why we have the other organs being affected. And so when you lose, for instance, your kidneys, so you go into chronic kidney disease or even eventual kidney failure, that kind of need is different from someone who has lung complications. Maybe the lungs also end up collapsing, and so they need to be on ventilators or need oxygen cylinders, so they're supported with that. So you move around with an oxygen cylinder. I'm sure there's someone in the news who we saw some time back.
During the elections?
Yes, yes.
During the elections?
Yeah, the lady who had the oxygen cylinder in the car. So these ones are losses that are specific to the kind of organ that needs the support. But then generally, most of the people who eventually develop complications may need support at home and also support in the hospital. Whereas while in the hospital, we still have the nurses, we have physiotherapy or occupational therapy that is provided for them. Even when they go back home, they can still have the occupational therapists come in to help. But then if they cannot, for instance, do things for themselves, albeit for a short while, maybe for the first 3 months as they're recovering. They cannot shower, they cannot cook, you know, those basic things, basic living needs, then they can get that support from home. But then when it comes to specific organs, there are those that will need the intervention of health professionals. So for instance, if you've lost a kidney, one kidney, or if you've now gone into total kidney failure and you need to have dialysis done, then you come to the hospital, then we do the dialysis for you. So it will be more specific. If it is hearing loss, if for instance 1 ear, for whatever reason is not able to hear well, or the infection, subsequent complication of the infection, then we give you support with external auditory equipment. Yes.
I came across some piece of information that I would like you, Sam, to clarify, and also you, Dr. is that not all strains of meningitis are vaccine preventable, so being able to recognize the symptoms is crucial. What would you make of that statement?
That is true. As we've explained, there are various causes of meningitis. Bacterial, viral, parasitic, and so there's bacterial, parasitic, and viral infection causing meningitis as well. Up to 90% of them are vaccine preventable. Now, the way life is, it is man against microorganisms. They tend to be always a step ahead. Research is ongoing, and it has been. Today, we have 26 in general, not just meningitis, 26 vaccine preventable diseases. But there is research on 20 more, including the one we mentioned the last time I was here, HIV, for which research is still ongoing. So today, up to 90% of the strains causing meningitis are vaccine preventable, but work continues to research on the rest.
Right.
Yes.
Is there a possibility it can recur, even as much as you've been treated and you're good? Inaweza kuwa na chapter 2 ama season 2.
Yeah, maybe I should. it tends, it so happens, especially for bacterial infections. Now, bacterial infections, suffering from pneumonia today does not mean you cannot suffer from another bout. It may be rare, but it can happen. And that is why, even post-recovery, it is important to have yourself immunized. Some conditions, like measles, viral, if you recover, then you are immune for life. That's true. But then for others, and especially so bacterial infections, you are not immune by virtue of having suffered one bout of infection.
I think just to add on, that whatever you said is very spot on. Also, you can suffer from 2 different strains. So for instance, you can go down first with the viral one, which doesn't really take you anywhere. You end up recovering even with limited or no medication at all. And then as a subsequent infection with bacteria, now on another organ, for instance, pneumonia, you end up developing now the bacterial meningitis. So it can occur and recur.
It can occur and recur. Vita zingine mi huambia ni za kiroho. You need to pray also. You really need, because I think that will be too much to bear, right? It will just be too much to bear. 4 minutes to us winding up this interview. The vaccine is readily available in Kenya?
Yes, it is available.
I can walk into any medical facility and get it.
Please do.
Bila kizuizi.
Yes, consult your doctor, consult your clinic or hospital, and they will be able to advise you.
There you have it. Walk into any facility, get this vaccination. It's very important. You don't want to be... I've seen clips and videos of people who've been taken down by meningitis. I mean, it does influence the quality of life, right? And it's not funny, guys. Prevention is better than cure. So kindly, if you can, and you should, get vaccination, right? Is it costly? On average. Because Nigeria hapo pia ni conversation ingine na Wakenya. How much?
It is not just one vaccine, so they are different. There are options. So and the client.
Again, on average.
I think on average it will take you back approximately 5,000 Kenyan shillings for one shot. And as I said, for anyone over the age of 2 years, you only require one shot.
Yeah.
Yes.
I mean, if you're making rain.
Dr. having experienced meningitis, can be able to explain whether that is reasonable. It would not be really in my place to say.
Go ahead, Dr.
Is the cost versus the benefit something to consider?
Cost, yeah.
I would say that going down with meningitis is a long path, and recovery takes weeks. When we make the diagnosis, you first of all have to go on injectable medications, which officially we don't give them at home. You have to be admitted. In the event that you're improving and you can eat, you can drink and take your medicine, we can send you home, but then you have to make frequent visits back to the hospital. So when you look at the cost of treating it versus the cost of vaccinating against it, then I would encourage Kenyans to really consider going for vaccinations. And I was at the clinic over the weekend getting my daughter vaccinated, much younger though, and I overheard someone who looked to be well off saying they didn't want the meningitis vaccine. And of course I had a private chat with them. I was like, I'm here like you, but then I think you need to allow your baby to have this vaccine for the following reasons. And of course, sometimes because of any injection, any medication, there could be side effects. And the challenge right now is that information is out there, and sometimes we don't get the correct information. So some of the choices people make is because they are misinformed and not because they are informed.
That's true. It's the lack of it that causes this issue.
Yes.
Not even too much of it. It's just the lack of it. And if people are making it rain in clubs and everywhere else, really consider yourself and get this jab, okay? Gentlemen, thank you so much for coming to the show. It has been a pleasure hosting you this morning, and we do hope you've been able to capture a thing or two in as far as meningitis is concerned. Kindly, prevention is better than cure. We will insist on that. I will insist on that. Literally, like I'm on a payroll, but I am on a payroll, right? That's why I'm here. But kindly, let's all get vaccinated, and please be on the lookout for more information. Be proactive enough and gather more information on some of these conditions. The show is not yet off. In around 3 minutes from now, we shall be discussing matters devolution. Devolution is 5 years old. We have the Big Four agenda that was launched by the Jubilee government. That will be their blueprint for the next 5 years. But then again, what are some of the issues that come with devolution now that we are 5 years of age as far as the system is concerned? What should you be on the lookout for in as far as the discussions and the conversations that will be happening in Kakamega are concerned? All that and much more coverage of that begins right now. We've got, in 3 minutes time, we've got a team in Kakamega that is covering the event live, and if possible we shall be bringing you the live pictures of what's happening there as we are having that conversation with governance experts who are already in studio with us this morning.
I had goals. I still have the goals I haven't fulfilled.
Enyewe mzee yangu alikufa. Mtawachia nani watoto?
When a family member is diagnosed with cancer, the family gathers around them and offers them support. The role that they play in a cancer patient's life is simply undeniable.
It's important you get support from your family, and before you go to support groups.
If I had met somebody at that time who encouraged me and told me, yes, look at me, I am fine, even you will be fine, it would have given me that much more psych to fight.
shuffling.
Where will magical scenes take you this April?
It's not far from Nairobi.
Is it to a place you haven't been to?
Yeye anaangazia yale mambo ambayo yanahitajika katika maeneo ama mandhari hayo mazuri.
Magical Scenes highlights Kenya as an ideal tourist destination right from location.
It is a land characterized by hills.
All the way from the islands to the mountains and maybe to the desert.
Mimi napenda sana kuangalia Magical Scenes ndio inielimishe kama Mkenya.
Magical Scenes with Irene Muchuma Odin.
The ride seems shorter.
Thursday at 8:30 p.m. and 9 p.m.